hemoglobin A1C. And so anyway, they can be drastic, and you can even feel really good. And you go in, but usually the presentations are, I will go into the doctor and you feel like you have flu-like symptoms, and you feel really, really bad. So, here's that first one I talked about, the hemoglobin A1C. Basically what that is, that's the average of your blood sugars over the past 3 months. And really, you don't have to be fasting to do them, but I like people to be fasting. However, it, like I said, it measures is a percentage. Now, what I like to see in my patients when I was practicing to have a hemoglobin A1C like about 6.4, 6.3 or less. When they start creeping up above that, they have all these fancy terms now. Oh, you're pre-diabetic. No, you're just diabetic or you're not, in my opinion. Then, the higher your blood sugar, the more hemoglobin you have to have sugar attached. And if you see right here, if it's 6.5 or higher on 2 separate tests, that means you're diabetic. Now, if you have see, there's the pre-diabetes stuff, between 5.7 and 6.4. And then if it's below 5.7 or less, that means you have normal. You're normal. So then you have a random blood sugar test. They rarely do those anymore. The gold standard is that hemoglobin A1C test. And then a fasting blood sugar. Now, let me tell you about that fasting blood sugar. If you have a pre-existing condition such as you have cardiac disease, you have high blood pressure or something like that, that blood sugar can vary a little bit based on what you've eaten, etc., etc. So, if that one should be fasting, if you read this, a fasting blood sugar level less than 100 is normal. Now, if it's 100 to 125, here again comes the term pre-diabetes. Now, if it's 126 or higher, on 2 separate occasions, then you're diabetic. They rarely do these glucose tolerance tests anymore. That's where you drink that nasty stuff that's really high in sugar, and you do have to fast for that. And then they do have a urine test that you can test for ketones, and then ketones are a byproduct when muscle and fat are used for energy. However, a lot of people test for ketones, but what are they doing? They're on low-carb diets. And what do you think what spills over to you when you decrease your carbs? You're going to go in and make your body ketonic. So people who are on a low-carb diet spill over ketones into their urine. So, there you go. Now, let's talk about type 1 diabetes. If you have type 1 diabetes, your pancreas doesn't make enough insulin or make very little insulin. So insulin helps your blood sugar enter the cells to use for energy. So without insulin, your blood sugar can't get into the cells or build up in the bloodstream. So it's damaging to the body, and it causes many of the symptoms of diabetes and causes the complications of diabetes, and we'll get into those in a little bit. But this can develop at any age. It used to be called juvenile diabetes. But anyway, if you notice here, it's less common than type 2, and then 5 to 10% of people have type 1. Now, type 1 symptoms, they're called, the fancy names are polyuria, you urinate a lot, polydipsia, you drink a lot, polyphagia, you eat a lot. Those are the 3 polys. And then you lose weight. So, numbness and tingling of the hand, you feel very fatigued. Now, all diabetics have this. You have sores that heal slowly. All diabetics do. And you have more infections than normal. People who are diabetic, except females, have urinary tract infections all the time. And you might have nausea, vomiting. So, these are not all pertinent to type 1. You can have some of these at type 2. For type 1, you are going on insulin. There's no way around it. You're also going to have to check your blood sugar. Fortunately, in this day and age, you don't have to, they make a wonderful thing called a continuous monitoring blood glucose system. Those are like those Dexcom things that you can put one here in your arm or wherever, and you can sync it right into your phone, and then you can monitor you don't have to poke your finger. The number one complaint I had when I was in practice is, I don't want to do that. I don't want to have to poke my finger. Okay, you don't have to do that. You don't have to do that if you don't want to. But then don't call, it's like, you don't want to check your blood sugar, but then I explained, if you don't check your blood sugar, then this is what's going to happen to you. You could pass out, you could do this, you could do that. So, I am so glad they have those things now. And listen, see this last one, we all have this. But stress, when you're diabetic, makes it harder on your life. It makes it harder to manage your diabetes, makes it harder to manage your blood pressure and your blood sugars. You need to get regular exercise, get enough sleep. You need to talk to your doctor. And another nice thing is if you go to a diabetic educator after you're diagnosed and you get some helpful hints and you go to diabetic education that helps you with meal planning and all that stuff, you're going to be able to deal with it a whole lot better. Now, type 2. 90 to 95% of people with type 2 diabetes. And about 38 million people have it. And basically put, insulin is a hormone made by your pancreas that acts to regulate your blood sugar. Your pancreas makes more insulin to try to get those cells to respond. Eventually, as your pancreas can't keep up, your blood sugar rises, and there you go. It damages to the body and can cause, here you go, 1, 2. They call it the triad. Heart disease, kidney disease, and diabetes all go together. And it can develop in any age, but you can prevent this. Now, if you notice, see the same signs in type 1? But the thing down here at the bottom with type 2 can take years to develop. Now, treatment for this, healthy eating, regular exercise, weight loss. Now, type 2 diabetics can do what they call oral agents. That would be like metformin, Januvia, all those newfangled ones. They now have all these little shots for people. That cause weight loss. They took them and gave them to people for weight loss, and then for the diabetics that needed them, cost them $600 a pop out of their pocket. That's all the what was it? Their Mounjaro and things like that. And then monitor that they need blood glucose monitoring. Excuse me, I can't talk. But anyway, or again, a Dexcom will work for them too. So, but those injectables that you only have to use once a week have side effects. Number 1, nausea. Number 2, vomiting. And number 3, in severe cases, pancreatitis. Now, lifestyle changes with diabetes. Take your medications as prescribed. Exercise. Get your checkups. I saw my patients in the office every 3 months. They got a hemoglobin A1C every 3 months. And when that hemoglobin A1C normalized, they saw me every 6 months. Manage your stress. Stop smoking. The number 1 thing I could say is stop smoking. Your vessels are already, how can I say, I don't want to say the word damaged, but they're kind of already compromised by your diabetes. So you can kind of slow down that by stopping smoking. And I would say, watch your alcohol consumption. They make skinny everything nowadays, and they make everything sugar-free. And watch that. As a diabetic, you need to be watching your carbs, because like I said, those carbs break down into all kinds of things. And if something's sugar-free, you better be reading the package label, because there's all this sucrose and all those oses on that back of the package. Now, eat healthy, exercise, take your medicines, don't be skipping stuff. Get your checkups, stop your smoking. Here again, same things as I said, but this is the one thing I want to tell you. If you make small changes, it's going to have a big impact. I'll give you a little personal story. When my husband was diagnosed with type 2 diabetes, and I gave him all the booklets to read, he said, I might just be, well, eating cardboard. And I said, listen, I'll go on this, we'll go do this together, and I'm not diabetic, I might add. So, you go through small changes. You know, if you like, for instance, you like butter, you go to margarine. If you like whole milk, you go to 2%. If you like white bread, you go to wheat, but you limit, you start watching your carbs, because carbohydrates turn into sugar. So, I will tell you just read the labels. Go to a diabetic educator. Anyway, so, with that being said, does anybody have any questions? I can't stress enough before I end this. You are going to be your own best friend when you're diabetic. Read. There's a wonderful little instrument out there. It's called Google. And the American Diabetic Association, the ADA, puts out a plethora of resources on diabetes. In fact, when I did my doctoral capstone, it was on diabetes. If you need to have annual blood work, and they should check your cholesterol. Make sure you're checking your blood pressure at least annually. And if you have high blood pressure, make sure you take your medication regularly. And make sure you're seeing your provider at least once a year. So with that, I'll entertain any questions. And as I say, the American Diabetic Association has good resources. There is a local diabetic educator here in town at the local hospital. And I am the executive director at the Family Health Care Clinic at 1820 West Hensley. So we have resources there too. Thank you very much.